Yeah.
Hi, I'm Dr. Mary Evangeline from Vasan Eye Care, Trichy. Today, Dr. Shibu Varkey and me will be discussing the various facilities available at Vasan Eye Care, Trichy. I hope this interactive session will be useful to all of you. Cataract is predominantly the most common eye surgery done worldwide, and generally patients come wait till they are totally blind to undergo the surgery. What would you suggest?
Well, waiting till they are totally blind, it means the cataract becomes fully mature, which in itself is a risk for cataract surgery. It is advisable that the cataract should be removed when it is immature or soft or fully formed. So at this stage, the patient is not fully blind. He may just have some blurring of vision, he may have some glare at night and some difficulty in night driving. But removing a soft cataract is much easier and the chances of a complication in cataract surgery is very less. So definitely surgery must be done much earlier than waiting for total blindness.
Some patients with systemic diseases like diabetes and heart diseases, they present very late for cataract surgery.
Yeah, see, cataract is a disease of old age, and most old patients would have diabetes or heart disease or hypertension or such problems. But since cataract is done just with drops, without any injection or introducing any medication into the body, it does not in general affect their general diseases that they have. So if they have a well controlled diabetes, blood pressure, heart condition, cataract surgery can be boldly done by these patients. There is absolutely no problem.
There are different kind of IOLs available now, like monofocal and multifocal IOLs. Can you tell us about multifocal IOLs?
Multifocal IOL gives a lot of advantage to the patients that it helps them to have distance, intermediate and near, like for driving, computer and reading, all without depending on glasses. So multifocal IOLs give a lot of advantage that they don't have to depend on glasses at all. The only thing is that multifocal IOLs should be done in patients who have a healthy retina, which means it should not have diabetic retinopathy or they should not have macular degeneration or any other disease of the retina, so that the full benefit of the multifocal can be experienced by the patient. And also, multifocal lenses should be done in those patients who do not have any complications. So it should be done by an experienced surgeon who's got a lot of experience in doing multifocal lens surgeries. So multifocal lenses can be done for any cataract for any person, provided he has a healthy retina and the surgeon is well experienced in that.
So, do all the patients who undergo multifocal IOLs have 20/20 vision?
Well, all patients with multifocus may not have 20/20 vision, but definitely they'll have a lesser dependence on glasses.
Okay.
And in case they have some residual power still after multifocus, we can use a LASIK laser to correct that power and bring them to 20/20. It's possible.
Some patients request for bilateral cataract surgery. What would you
Yeah,
suggest?
doing both the eyes at the same time in cataract surgery is definitely possible. It's done internationally. There is an international society of bilateral cataract surgeons, and I have been doing simultaneous bilateral cataract surgery for the last 6 to 7 years, and definitely more than 20 to 25,000 patients have had this form of surgery. So in our setting, in our situation, we've not found any problem with this kind of approach.
Can multifocal lens be used in one eye only?
If a person already has a monofocal IOL in one eye and he has 20/20 vision without glasses in that eye, then certainly he can have a multifocal IOL in the other eye. Best situation is to have multifocus in both eyes. But if the patient already has a monofocus in one eye, that is not a contraindication or that is not a reason to refuse multifocus in the other eye.
Supposing a patient already has a monofocal lens in that eye, and he wants it to be removed and have a multifocal IOL. How good is it?
IOL explantation or removing an IOL is a surgery which is done. If there are a lot of people who've had monofocus some years ago and now they want to have glass free vision, they don't want to depend on glasses, it is certainly possible in an experienced hand to remove that lens and replace it with a multifocus, provided, again, as I said, the retina is healthy and the eye had an uncomplicated surgery earlier.
Hope you had a good interactive time with Dr. Shibu Varkey. You can subscribe to us and contact our customer care for further details.